So back pain is by far one of the most common things we see in physical therapy. So let's talk about it. First, let's talk about a big difference in pain, chronic versus acute. Acute pain is usually pain immediately after an injury, so we're talking usually on the order of days to weeks if addressed right away. Whereas chronic pain is something that lasts months or longer. So with two different areas to talk about, we're going to do this as more of a video series. So we can talk about how we both address chronic pain and some of the other various treatments that may be used for acute pain. We'll start with chronic pain, because more often than not, people with chronic pain have already been to the doctor to determine a root structural cause of their pain. Whether this was an old injury that would involve a degenerative change, the good news is there's often still something we can do about it. For starters, I would recommend looking at our video on pain signs that we just published, because an important aspect of chronic pain is also addressing the brain's role in processing pain. Changing how we perceive pain consciously can really affect the unconscious parts and direct those messages and can decrease our severity before we even get to work on the structural changes in our body. Along with addressing how pain is processed, of course, we're going to want to take a look at the different physical factors causing your pain. If you tend to have pain throughout a large area of your spine, one of the things we'll want to work on is the endurance of the spinal support muscles. These muscles may be needed to support your all day long, which is a lot of work. So if we've not been doing what is known as overload exercise specific to the right muscles, it's easy to overuse them and get pain messages from them. For patients like this, working on muscular endurance would be a huge step. Patients with a lot of stiffness and range of motion limitations, on the other hand, may be getting pain messages so that they don't go outside of what the brain perceives as a safe range. Often you'll have pain all the time without any movement, even if it's bad at rest. But with gentle, deliberate stretching and mobility, we can often regain a lot of these ranges, allowing you to move much further with minimal of any aggravation. With stiff joints, movement is medicine. Doing it the right way can actually even decrease your pain at rest. Even issues with disc bulges, herniations, degenerations, these all benefit from the right movements, as the soft tissue of the disc itself is imbibing them with synovial fluid, our body's natural WD-40, that permeates areas to move more. Guiding movement in the right planes with the right amplitude will be an important thing for everyone to learn in therapy, as well as making sure you develop a good knowledge of pain science, the why do I hurt about things. So in essence, we want to address both the structural causes of chronic pain, but also the changes in the brain that occur over time when we've had pain for a very long period. Because pain is a trying to protect you response. If we're trying to protect something, even when it's structurally sound, we're still going to perceive pain. So we need to address both the structure and the nerves that perceive that pain. Next week, we're going to start a longer series on how different types of acute pain can affect different tissues and what we can do for them. This will also often apply to people who've had chronic pain because those acute injuries can cause your chronic overload. So, stay tuned and we'll have some fun.